people who are coming in as we start talking. So again, welcome back to our Positive Behavioral Interventions and Supports ECHO series. This series is being supported by the Cigna grant that we get from KU Medical Center here, and also by the Kansas Center Autism Research and Training and KU Pediatrics at the University of Kansas Medical Center. So once you join, you are muted. But if you have questions, please do feel free to chat, and also to feel free to unmute yourself later, especially when we have a case discussion. We really would appreciate it if we can see your faces. Thank you all who are already having your camera on. If you can, and it's okay to do that so in a safe environment, please, we would appreciate seeing your faces. And then at the end of the entire series, we would be able to send out a certificate. So please make sure if you want to receive that certificate of all the hours that you have been attending and learning together with us, making sure that you have your names on there so that we can get that information correct for you. Next slide, Jess, thank you. Yes. So first, we want to do a really quick introduction and let us know who you are. If you can write down your name and organization in the chat, that would be great. Also, we would love to hear from you what you hope to learn from today's participation. And my name is Alice Zhang, and I am a behavioral analyst and also a faculty member here at KU Medical Center. I will turn over to Dr. Linda Heisman-Powell and Dr. Jessica Schuttler to do a quick introduction as well.
I'm Linda Heisman-Powell. I'm a licensed psychologist in the state of Kansas, and I'm also a board-certified behavior analyst at the doctorate level here at the Kansas Center for Autism Research and Training in the Department of Behavioral Pediatrics. Is that correct, Jess? At the University of Kansas Medical Center.
That's right.
And so we'd like to welcome everybody to this. We've had the good fortune of being funded by Cigna to be able to bring this PBS series to those of you that are on this meeting, this call. So we're glad you're here, and we're glad that we have Jess with us today to be able to present. So Jess, Dr. Schuttler.
Well, thank you, Dr. Heisman-Powell, and thank you, Dr. Zhang. Thank you, Mackenzie. Thanks, everybody, for being with us today for a little bit of learning opportunity over the lunch hour together. My name is Jess Schuttler. I am a psychologist and an assistant professor here at the University of Kansas Medical Center in the Division of Developmental and Behavioral Pediatrics. I'm also the training director for the Leadership Education in Neurodevelopmental and Related Disabilities Program, or LEND, as we call it for short. So I'm grateful to be here with my colleagues from our clinical practice, research, and training activities to share a little bit about what I've learned and what I've been thinking about when it comes to supporting people with autism or intellectual or developmental disabilities and co-occurring anxiety and depression. And hopefully we'll give you some things to think about, some ideas of things to try, some resources to explore. And I'm really looking forward to discussion of our case today and thinking together about how to support one of our colleagues, real life, walking away from our conversation today. So thanks all so much for that opportunity.
Great. So thank you, Jess, for the introduction, and thank you all for putting your information. I see a lot of familiar names and faces. We really appreciate your continued participation. So today, again, we will have the similar ECHO format of presentation. We will have a short didactic presentation by Dr. Schuttler, and we will also have a case presentation where we really expect a lot of discussion and participation from you all as well. And then we will be doing some, asking some group discussion and having a short summary at the end. And also just want to point your attention to this level up sign. So when you see this sign, we want to really hear from you. So please feel free to type in the chat box how you have applied some of the concepts that we're going to later talk about in your setting. Next slide. Thank you, Dr. Schuttler. Again, I have been talking about this repeatedly, assessments. So again, we really want to collect some data to really show that to our funders that what we do have some positive impact in the community. So we will be sending you all a really short post-training survey that probably only have less than 10 questions and fewer than 10 questions. And so if you can help us complete that, that would be greatly appreciated. Next slide. We also really would love for you to participate in the rest of the echo sessions, to participate in a case if you can. So feel free to reach out to us if you want to present in one of the sessions. We still have, each month we will still have a presentation until the month of November. Thank you. Next slide. Okay, I will, from here, I'll turn to Dr. Schuttler to start her presentation.
Great. Thank you so much, Alice. And thanks again, everyone, for being here. Thanks all of you who've entered your information into the chat to tell us a little about who you are and how you might be approaching this topic that we're going to be learning about today. I see a lot of folks from a school setting, educational setting, folks with mental health or assessment background, school social workers, school psychs, other folks from maybe nursing backgrounds and healthcare backgrounds. So we have really nice folks with a wide range of backgrounds, and I hope we can, that'll really add to our discussion as we talk a little bit more about this. So again, our topic is that we want to kind of discuss and understand a little bit about depression and anxiety, and especially give you all some consideration for all of you folks working in the community and trying to support folks with autism or other intellectual or developmental disabilities. Just a quick overview of kind of our learning goals and our agenda for today. Our agenda is going to kind of follow through with these three kind of goal areas. First, I'm hoping that you all sharing in this with me today will feel like you learn a little bit more about the presentation and prevalence of anxiety and depression for teens, young adults, and adults with autism and intellectual or developmental disabilities. I'm also hoping that you learn and get some ideas and some resources for adapting some of the things you're already doing to increase accessibility of evidence-based strategies for addressing anxiety and depression. And then the third part of our time together today, hopefully we'll get the opportunity to kind of exercise these new muscles that we're starting to grow and practice applying the strategies during our case study discussion. So what I'd like to do, just to start us off, is I'm sure you're all here because there's one or more people that you would like to feel more confident, competent, comfortable supporting. And so I just want to take a minute to recognize those folks. I know we probably all have someone, whether it's a client, a student, a family member that we're thinking of, and you've already sort of jumped ahead and shared your role. And most of you have shared where you're at as well. So if you haven't told us maybe where you're located, what part of Kansas you're in, we'd love to have that added to the chat. But love to see where all across Kansas we're having an impact. So take a moment, you can take a moment and do that too. Awesome. We've got folks in Junction City. I think I've seen folks in South Central Kansas, folks in Wichita, folks in USD 259, folks from Wyandotte County here in the Metro, Olathe, KUMC, folks from Sunflower Health Plan serving folks across the state, folks in Jackson County, DeSoto School District. Awesome. Thanks, everybody. It's really neat to think about connecting across the state together as we're doing this. Okay, so let's talk a little bit about presentation and prevalence. Whoops, excuse me. There we go. Many of you may be familiar with prevalence rates already, but I think it's always important to kind of start with that and understand really the potential impact that anxiety and depression have on our general population, and then as well as the unique considerations for folks with autism or other intellectual developmental disabilities. So I'm not sure if you knew this, but prevalence rates for adults with autism and or intellectual developmental disabilities range from, anywhere from as low as 20 in the 20% to 40% across anxiety and depressive symptoms. And you think about comparing that to the general population is really, it's around 30% lifetime experience with anxiety and 7% experience with depression. That's folks who are in their adult range, okay? When we think about teens and youth, the prevalence rates can be as high as 42 to 79% of folks who are identifying with having autism or intellectual and developmental disability who are also experiencing co-occurring anxiety or depression. And that really stands out to me when you think about in that teen population, the general population, that's really only happening, folks are maybe 30% of the time, that's 1 in 3 folks with anxiety, 13% of teens who are reporting kind of depressive disorder symptoms. And these are coming from national surveys of folks across the country to try to get these prevalence rates. So what we understand is that folks who are experiencing autism or intellectual and developmental disabilities are really at higher risk. They're experiencing anxiety and depression at higher rates. And we can maybe understand that, right? That if you, progressing through your developmental years and developmental stages is difficult enough. And then if you add on to that a complexity of having differences in your social communication, differences in your social kind of interpretation and understanding, or differences in your cognitive ability and your ability to kind of process the complex nuances of social interaction and other elements of being kind of a teen or an adult, navigating all those aspects of life, it's not surprising that that's a more stressful experience and that we see folks with higher rates of anxiety and depression. Something I particularly want to highlight is for females with autism, these rates are even higher. They're at even increased risk than other teens or other female teens from the general population and other males who are on the spectrum as well. So let's think about this. While we know these rates are higher for folks, historically, these sort of support needs have been under-addressed. I'm sure you're all here because you know someone or are trying to support someone, either as a clinician or trying to get someone that you know connected to a clinician who feels comfortable or who has that expertise in supporting someone with that combination of both anxiety and depression and autism or intellectual or developmental disability. But we're, training programs across the whole don't touch much on developmental differences and developmental disability. And then we have folks out in the field and our silos are sort of siloed, right? We have developmental disability service systems and then we have mental health service systems, and those systems aren't really talking to each other as well as they could. I think our schools are doing the best job they can of connecting and recognizing support needs across a range of the student population that they're seeing. But as those folks are aging out, getting into those teen years and the post-teen years, that navigating those service systems just becomes more complicated. There's also been some concern from the field that we've been over concerned with maybe more coercive or compliance focused approaches rather than thinking about what really is the source of the concern for the individual, for the person. How do we help that individual person come to their own understanding, and how are we sure that we're supporting that person in their self-directed and self-identified goals? And certainly we need to identify kind of creative ways or adaptive ways to do that. So I think we really could argue that folks with developmental disabilities are really an underrepresented and an underserved population when it comes to mental health services and supports. And so we really need to think about how we're tailoring those services. And I'm so glad you're here for us to talk a little bit more about that. Okay, so first let's talk a little about kind of presentation considerations. I think kind of 3 big takeaways for you as we're thinking about this today. First, incorporating support of others is going to be really important to understanding a person's experience at a range of developmental difference level, right? Or a range of cognitive capacity or social communication differences. We really want to understand and look to folks around, not because we only want to hear that perspective, but because they can really add color and context to us in getting to know an individual and a person. Those supportive others are important because sometimes those social communication differences can overlap with some of the symptom presentation. So for example, I have friends and colleagues that I know who, because of being on the spectrum, may have a more neutral, or what we might describe as like a flat facial expression, or may have more difficulties with reciprocal conversation. That doesn't necessarily mean that that person is experiencing a depressed or reduced mood, but it does mean that we're going to need to take those sorts of social communication style into account as we're trying to make interpretations about symptom presentation. And I think it's also very important to look to kind of changes in behavior. So those supportive others can help that your kind of focus person, the target individual, that your client that you're wanting to support, in helping to monitor and understand what's kind of a baseline and what has changed. Has appetite, social engagement, self-care skills, certain patterns of thoughts or behaviors, have those changed significantly since a precipitating event or since some transitional phase that might be contributing then to an increase in kind of depressive or anxious symptoms. So incorporating those supportive others, considering how has that behavior changed, what's been different, and understanding what are a person's kind of communication preferences, styles, differences that may sort of filter what we're asking about or what we're seeking to understand about that person. Okay. Trying to stay on track with my time here. Okay. So an approach that I would really like for us to spend some time thinking about and exploring adapting today is something called cognitive behavioral therapy. I'm sure most of you have experience with this or have been exposed to this. It's the idea started by Aaron Beck and then Judith Beck, and further on from there, that when we help folks understand the relationships between their thoughts and feelings and behaviors, we can help them make socially meaningful change in their life and can help, reduce some of those anxious or depressive symptoms. I wanted to take a minute just to walk through sort of the 10 core components of cognitive behavioral approaches. And I would love to try for you to start kind of making the connection. And so level up with me, enter into the chat as you're thinking about it, how some of these practices, while I'm kind of bringing them to you from the context of cognitive behavioral approaches, how might you be using some of these approaches in the ways you're already working with students, right? Whether it's in your classroom, in your kind of counseling practice in schools, in your nursing practice, in your, in your family. Do you use any of these approaches already? And how might you begin to build off of them? Okay. So first of all, these kinds of approaches are based in this kind of, that we're flexible. We're like inherently evolving in our formulation and understanding of a person, right? What problems they're bringing to us, what their kind of context of support is. We as providers and partners are going to be warm, caring. We want to really bring genuine regard and a competence to the interaction. So, we're going to share expertise that we have and continue to work to grow in that competence. And so I think participating in echoes and things like this is one way that you are all obviously committed to doing that. Cognitive behavioral approaches are really designed to be collaborative and active participation. It means it's a conversation. The client and the provider are really talking together about what's important, what are our goals, what are we going to be working on, what's our agenda for today, and how are these strategies that maybe me as the provider with that expertise is bringing to you, how are we going to adapt that and shape that to what the person needs. We're going to set goals together. We're going to target, addressing barriers to reaching those goals. We're going to try to stay focused here in the present. We're going to think about what can I do in the here and now to make a difference in what's happening and help me move closer to my goals. We're also going to aim to teach clients how to help themselves. So, I am not here as the master wizard of cognitive behavioral therapy is going to wave my wand and fix your problem. What I'm here to do is be a great resource and a great toolbox for you to offer you suggestions and strategies that you can use and the supportive people around you can use to help make change. Obviously we're trying to support a person to feel better. So to address symptoms, to figure out how to solve problems, to resolve some of the most pressing situations, and then to think about how could I maybe anticipate or prevent problems in the future. And then we try to do that in an efficient and effective way. So most of our sessions together involve, these three components. We're going to kind of check in, see how things are going, make sure we're on the same page as far as our agenda. We're going to do some work together. We're going to work on our problems, do some problem solving. I'm going to teach you some strategies to use. And then we're going to kind of make our plan for going forward. What are you going to go try after we've talked now? And how did we do today? What could we do better next time? How could I make these concepts easier for you to understand? Or how could we make them more tailored to what you need to do in your day-to-day life to make them happen? Okay, we're going to help people identify and understand those relationships of thoughts and beliefs, and we're going to use a variety of techniques to try to change those thoughts and moods and behaviors that aren't so helpful. There are 6 main kind of strategies that I am summarizing here on this slide that then we're going to talk a little bit more about how we might adapt on the slide after this. So many of you who might be familiar with cognitive behavioral approaches may be familiar with these, but I'll walk through them really quickly. Thanks, Linda, for adding into the chat a little bit about how you've been using some of these strategies. And again, you can level up and add into the chat too, other ways that you maybe are using some of these strategies on this slide. Okay.
So Jess, I have a question. Yes. Can we pop in with questions?
Sure. Yeah.
One of the things that I try to do is like, can you go back to the previous slide?
Mm-hmm. That's not what I'm doing.
Like on the one that number 4,
mm-hmm.
goal-oriented, problem-focused. One of the things that I don't do so much with my clients is focus on the problem, because if it's maintained by attention,
mm-hmm.
right? So one of the things is goal-oriented, but then actively teaching a replacement behavior.
Mm-hmm. Mm-hmm.
Where does that fall in the CBT approach?
So some of this language is, we might shape it a little bit too, because I would also say that in my practice, we start with this understanding of like, what's the problem and what's the thing that we need to change, and what are our solutions that we're working towards. Yeah. So we have a pretty specific type of solution or a kind of replacement that we're going to think about talking about how to address and how to reduce. But I would agree, we're not going to spend a lot of time beyond having an understanding of like, what's getting in the way, what's the challenge? Okay, well, what are our alternatives that we're going to try instead or try differently? Thanks for clarifying that one.
Yeah. Okay. Thank you.
For sure. Yes. And yes, absolutely. Christina, thank you. Mindfulness is something we're going to talk about. Yes, absolutely. So mindfulness would actually, in my mind, kind of fall within this relaxation and self-care strategies. So we're teaching folks ideas for kind of coping and managing themselves. So understanding that all of our feelings are natural and normal. There's no such thing as a bad feeling or a wrong feeling, but how we respond to that feeling, manage that feeling, take care of that feeling, there's going to be more or less helpful ways that we navigate that, right? Absolutely. Problem solving is another great example, Christina. I feel like you could be doing this presentation with me here, throwing these out here on the slides. Absolutely, right? So we're actively supporting someone in problem solving, but I think we're also taking it a step further and we're teaching them the framework for how do you solve a problem. So you'll see here in a couple slides, I use a lot of visual supports to help with that. So if you come to me and you're going to tell me, okay, hey, Christina, I don't want to talk about my test anxiety this time. I'm actually really nervous because I got invited to go to somebody's birthday party this weekend and I'm not sure what to do. I'm not sure how to handle that. Well, that's okay. We can shift our focus if that's of most importance for everyone here in the conversation. What we're still going to be teaching is that problem solving strategy. And so I'm going to pull out my problem solving steps. We're going to fill in the problem solving map, but we're going to be targeting how do I work on feeling as comfortable as possible and making conversation during the birthday party. Whereas maybe my problem to solve, another week is how am I going to manage myself during that upcoming math exam or math test, right? Some other tools that we use, you guys can certainly jump into the chat if you're using some of these, is this idea of like, we're trying to use questioning and that experimental idea, like this idea of like, I'm here to ask you questions and ask you to try thinking about things in a little bit different way. I'm not saying you have to do this, but can you try it for me for a couple of weeks and let me know, report back how it works. Let's keep track of kind of what your mood's like after you've tried some of this mindfulness. Or, let's try out some behavioral experiments. Maybe we think about some scheduling of activities or scheduling of other things that we know are generally enjoyable for you. We try to do that on a regular basis and see if that helps improve your mood. Okay. And then we might do some mapping of helpful versus unhelpful thoughts, thinking about helpful versus unhelpful strategies or behaviors to use to navigate a situation. I'm trying to stay on my time here. So we have those kind of general strategies from cognitive behavioral therapy that we know have good effectiveness, can really help people of all abilities with making change, right? I wanted to also offer to you this set of kind of general adaptations that you could think about applying to some of the techniques and strategies that you're already using. So it's not that you need to have Jessica Schuttler's magical list of books or strategies that you're doing, but maybe you're thinking a little bit about, how do I consider each of these things as I'm sitting down to work with my client? So a researcher from a bit of a ways back, but we're still kind of using this criteria, so we'll kind of keep talking about it, named Hurley, kind of came up with this set of adaptations that they suggest and that we've seen used across the literature about how we adapt some of these evidence-based strategies like CBT to be used and be more accessible for folks with cognitive disability differences or autism. And they come across these ideas of thinking about, how can we kind of simplify or reduce complexities? How do we chunk things out? Do we do things in shorter sessions? How do we simplify or make more clear our vocabulary, our sentences? How might we incorporate different types of, interactive activities, drawings, homework assignments, filling in a visual, playing a game? How do I present this information at a level that it's most, cognitively accessible and understood? To think about, there's the language that's on the slide is directive style, but I think of it about just being really clear about your treatment goals. So understanding like, okay, so what I've heard from you is that this is what you want to work on. And so this is what we're going to be working on today. If you bring a situation to me you want to talk about, I'm going to ask you, do you want to work on this today? Or should we stick with our plan of what we were originally going to talk about? So just kind of being clear and concrete with that agenda and that outline and what you're going to do, and be willing to be flexible. This idea of involving caregivers. And I think also for our clients, as we as a culture are increasingly recognizing disability as a form of diversity and thinking about our clients in a context that may be inherently stressful because of components to the environment and advocacy that needs to happen on behalf of that client to be able to more effectively access what's presented to them or what's around them. How can we also be supportive allies and advocates with them and their caregivers in helping those environments to feel as supportive as possible as well? Okay, so I have, there's been a few, thank you guys for your thoughts around this language around helpful and unhelpful. I find that to be a more kind of, it's kind of a more neutral and non-judgmental way to think about these thoughts and how they're impacting folks. And also thanks Dr. Jung for your input about the kind of disability and rehabilitation approaches as well. I think our field is moving in this direction. We're recognizing more and more the need to adapt different, quote unquote, kind of evidence-based treatments and approaches to being able to be used with a variety of populations. And so I'm just offering to you three manuals, three sets of kind of more structured resources that I've found helpful to apply flexibly to my practice and that you might explore. So Facing Your Fears as a curriculum that was developed by Judy Reven and her colleagues. It's an adaptation of a group-based anxiety management curriculum, but with kind of it's really kind of increasing the ante in terms of visual supports, hands-on activities, concrete practice, and incorporation of caregivers. So Facing Your Fears is one curriculum. The Coping Cat workbook and Coping Cat curriculum has been around for a long time. Kendall and his colleagues have adapted it to be used with kids and young people who are on the spectrum. So that's available to check out. And then the emotion regulation skill system is actually a dialectical behavioral therapy approach that was adapted by Julie Brown, who's a social worker out of Rhode Island and has worked with adults who've had interaction with like the justice system and may have more kind of anger management or depressive mood kind of management support needs. And it's designed as a group-based curriculum, but I myself have adapted it for use one-on-one with clients and has been really helpful for folks in maybe some of that in that a little bit older adolescent to adult range as far as introducing a variety of concepts. There's actually a set of online modules that you can work through or your clients can work through together. And I find it to be really accessible and useful. So I don't have any financial interest in any of these curriculums or anything like that. They're just tools that I've been using and that I've been sort of pulling flexibly from, as well as how I've adapted some things of my own. Yes, thank you. We are recording. I know I'm talking really fast too. So I just wanted to throw up here a couple of slides with examples of tools that I use in kind of an earlier stage when we're working on some of that like emotional recognition, recognizing the relationships between thoughts and feelings and behaviors. You can see there's kind of a visual component that corresponds with different types of feelings. And then there's typically a numerical or some way to sort of gauge size or strength or intensity of an emotion. And you can see it ranges from really visual and colorful to more texturally based, black and white. There's a variety of different ways that we can utilize this. We can also keep it really simple where we're just measuring emotion and strength, to making it more complex where we're pairing language and vocabulary related to those emotions, description of the person and how they're expressing those emotions, and then this sort of skills recipe or this idea of like wherever that intensity of my emotion is, here's a combination of strategies that I can use in the toolbox that we can be adding to within therapy to then address that strength of that emotion, if that makes sense. So these two colorful ones are ones that I've kind of been developed in-house, and that I also would give shout out to my colleagues here in the Division of Developmental and Behavioral Sciences who have been working on various versions of these over the years. The two in the upper right come from the Emotion Regulation Skills System curriculum. I'm going to flip on to the next slide just so you see some more examples, but please, as we're talking, add in, let me know if there's one of these that's really speaking to you, something that you're using. Looks like we've got some folks who use a 10-point scale, and it either can go more intense or either positive or negative, right? A coordinate plane that works well. Awesome ideas, guys. Absolutely. No, I think the scaling concept is just a really powerful one because it takes this really, oh, thanks, Christina, for showing that with us. Oh yeah, like a quadrant. That looks really sophisticated and a really nice way to kind of plot where are you at all over that potential dimension. I think I like the idea of just making that emotional recognition and identification visual, because it takes something that's kind of scary and abstract and seems like maybe uncontrollable for some folks. If we can start to gauge it and measure it, it doesn't seem so scary and nebulous. We can kind of get a sense of how it can move up and down, and we can feel empowered to do something with those emotions wherever we're at on that scale. The tools on this page are just some more supports that I've used when we've talked more about goal setting, an example of how we've used kind of a table or a kind of mapping out tool for behavioral activation and activity scheduling. Another visual when we've talked about kind of recognizing or understanding kind of sensations or perceptions, right? For some of my folks on the spectrum, it's just harder to kind of cue into that or clue into that. And so a visual support like this one from the Coping Cat, we can even do some kind of like body scan activities and notice right here in the moment, how are we feeling? And then we might think about a situation that's a stressful experience or maybe an exciting experience. And we can, kind of role play, what did those feelings and sensations and perceptions feel like in that setting too? I've also used some kind of scenarios specific to different folks and asked them to kind of map, which, for this person, Pokemon was of interest. Which Pokemon am I in this situation when this thing is happening? And there's kind of a visual support and a kind of a game kind of feel to that. And then similarly, another kind of support when we talked about kind of problem solving steps, I have a more detailed sort of set of problem solving steps that people can fill in. I also have this one that incorporated Minnie Mouse, which was one of my, a friend of mine's kind of key interest, and was really motivated by this idea of being a problem solver, just like Minnie Mouse can solve lots of different kinds of problems. So any other ideas, or any of these that you are saying, wow, I think I might try something like this in my practice? Feel free to enter that in the chat. Okay, so those were some quick just examples of tools and ideas, some considerations for you to think about. I would love for you to share with me in the chat any of your key takeaways, things that you might go and apply this week, or something you're going to go share with a colleague or a parent or someone else that something that you might try. And I'm going to apologize because I went a little bit over my time, but we'll get to still talk about our case. Thanks. Yes, the resources and scales can be focused on interest. Yes, I'm really just if I could put it into 3 words, I would say just kind of break it down. Let's think about how complex is this concept that we're talking about, and if it's not at a place where it's, you know, accessible to the person I'm working with, how can I simplify it? How can I make it clearer? How do I do it in shorter chunks? And how can I have patience that, just like any other skill that we may be teaching a person or supporting them in learning, they're going to move at their own pace. And the same is true for managing, you know, those intense emotional symptoms like anxiety and depression.
And I like how there's the adaptation of DBT, one of those resources that you shared, because often we have folks that have ASD or IDD, and they're you know, high enough functioning or cognitively intact that they can benefit from some of these strategies. And then having those visuals, if they don't have as much language, those visuals are a really great way that you can still use the strategies, but you do it in the context of visuals. I thought that was great. I mean, I use visuals and stuff all the time, but just like that cognitive shift of, oh, this visual can replace you know, that somewhat high verbal component to some of the CBT or DBT, and still be able to use some of those strategies, right, that work with more verbal clients.
Absolutely, absolutely. And those kind of verbal, those visual tools, those visual strategies can also be a way that we fade away the adult support that might be needed for somebody, where, you know, at first it's someone's kind of coaching you through using your relaxation strategies, coaching you through using some of your self-management tools. Eventually we can fade that person away, and I still, as the client, have the access to my visual support that is reminding me of all these things and that I can feel empowered to use in times of stress. Awesome. I'm glad to hear that this is helpful to your CASA teens, Michelle, who are moving into that more. They're focusing more on their own goals and independent living, right? Readiness. That's great. Yes, absolutely.
Yes, I have a thanks for all the great information. I'm curious to know, like, just between working with you know, young teens or young adults with IDD and versus with typical developing peers, how do you feel like, is there a difference in terms of involving parents in that process, or maybe it's very similar?
My practice is, at least in the last few years, has been more really focused on working with folks with some type of developmental disability or difference. But was trained as a school psych and have a few years of working in the schools. I would say, in my experience, the teens and young folks I'm working with are tending to bring a caregiver or supportive person into that session with them, or being more interested in having them there than maybe a teen without, like, an autism or intellectual developmental disability diagnosis. And so it's a balance to strike between that person being supportive and kind of a team member as that adult and caregiver, and also making sure that we are staying focused on the person who's the client, and that they're feeling empowered to share their concerns, to speak how they're feeling, and to set their goals that we're working on. So I think we're trying to promote that kind of capacity to make things happen for themselves in their life. For that team, we may have to be a little bit more intentional about it if that person has a history of developmental disability. Thank you for your questions and the comments in the chats, guys. This has been really helpful. Do we want to talk about